Alok, Pramod, welcome.
Thank you.
As it was mentioned, the topic is innovation in supply chain, or the need and the opportunities for innovation in supply chain. One of the ways, before we go into the intros, just to set things up, innovation, often people start thinking about AI, machine learning, robotics, whatnot, SpaceX and blockchain and all those kind of things. And I'm going to take a counter position today a little bit. Innovation that works, innovation that actually works and actually feeds the bottom line, innovation that solves real customer problems. I know that from our prior conversations that we are all on the same wavelength, that there is something more to innovation than just technology. So let's discuss different aspects and nuances of innovation. We have really seasoned leaders here, like Alok, Pramod, both of you, 30 plus years in the industry, variety of different aspects of supply chain, and really looking forward to it. So before we start diving into the topic, quick round of introductions. So I'll introduce myself, then Pramod and Alok. Introduce yourself as well as your companies and your previous company, I think, Pramod. So my name is Harshad Kanvinde. I run a consulting firm called Insurge Partners based out of Seattle and Mumbai. Have done a lot of work in supply chain strategy as well as digital innovation. In my prior life, worked at Amazon and Procter & Gamble before that. So have seen different aspects of supply chain innovation in action. And with that, without further ado, Pramod, why don't you introduce...
Thank you. So my name is Pramod Sant. I worked into basically electrical company first, electronics, Siemens, and then one day we came into pharma. Suddenly we took over from medical equipments with our core, but one day we found that we are into the pharma also, and that gives us a very interesting experience. So I was working with Siemens as the head of their import-export logistics, and now, as he says, that I don't do consultation, but I do some training, teaching, writing, etc. Yeah, thank you.
Hi. First of all, thanks Harshad, Reggie, for giving this platform, for giving this opportunity to engage and get back to my favorite topic of innovation in supply chain. Just a brief introduction. I am a lifelong supply chain professional, worked for about 34 years in Unilever, right from college to very recently. In all aspects of supply chain, global, regional, local, all end-to-end, from planning to manufacturing to logistics. And of course, was really fortunate to see a lot of innovation in supply chain through the several years that I spent there. And then last year, I took a jump to join Pharmarack Technologies. Pharmarack Technologies is a very unique enterprise. It is anchored by the pharma industry or a large part of pharma industry of India as investors, but more importantly as our customers and adopters of our services. And we really call ourselves a commerce to insights B2B platform, which is focused on improving efficiencies across the value chain, right from pharma manufacturers up to the chemists and eventually even the patients. There is a lot of opportunity for efficiency improvement through both digitalization, as well as use of big data analytics. And that's what we are doing. We are actually the largest B2B platform in India. Almost processing upwards of 7 million transactions every month across the ecosystem, and growing month on month, which basically shows the kind of confidence our customers have on us. And it will be great, looking forward to this opportunity of actually engaging with Harshad and Dr. Sant to dive into the topic of the day.
Awesome. So before, so one of the first themes that I want to address here. So one of the working at Amazon was tremendously impactful on me personally and professionally, and before that P&G. So my, sorry Alok, I mean, I love Unilever products too, but how to keep customer at the center of everything, and innovation not as a separate activity, but innovation as embedded in your business model and your DNA. One of the things that even in my consulting work I always talk about is the notion of real transformations happen in customer adoption, not in the technology, right? So unless someone is adopting what you're trying to do, unless that happens, innovation doesn't really mean anything. And that only happens when it's embedded, really embedded in your business. So along those lines, sustaining the innovation and the culture of innovation in the organization, or making supply chain needs to be the business of supply chain, and then you have the impetus to keep doing innovation. I wanted to hear from your perspective, Siemens, as well as your other outside of Siemens work, and Alok, your Pharmarack work. I think both of you have done those things in your unique ways. So would love to understand your take on how do you sustain innovation, or what kind of innovation in supply chain really does the magic and reaches the customer or the consumer, and what kind of innovation dies. Yeah. So maybe Pramod, you want to take the first stab.
Thank you. So before going into that, I just was listening to the earlier panel discussions and was saying, so there was one word that we are doing this for patients. That's the most important thing. Yep. So if you look at regarding patients, I feel we are using the word supply chain in very short manner. I think what you mentioned, should use the word value chain, because who is at the end receiving the patient, he need to have that value. So I will believe that we should use the value chain, and then the words come into really clarity. See, we have seen now, where are we today? I mean, people use term VUCA, but VUCA is 30-year-old situation. It came into 90s. Now we have come out of VUCA. We have BANI, brittle, anxious, non-linear, incomprehensible. And that suits more to the pharma industry and the healthcare industry, to be precise. If you look at the way which challenges which we have seen in last couple of years, they fit more into BANI than a VUCA. And how to handle that? So let us compare again the pharma industry with other industries also. I mean, you have Procter & Gamble and you have Unilever experience. So where does the pharma industry sits? If you look at, there are few pointers which we need to see is, for example, when you are into manufacturing of drugs or anything, what is your inventory turnover ratio? Other than pharma, other industries are doing very better in that. There are industries which are world class considered, they have inventory turnover of 50. That means every week. If you look at the on time full deliveries, other industry is doing far better than pharma industry. Then ready to fill, other industry is doing better. Then process capability efficiency, you mentioned the efficiency. That's the very important word, where the pharma is lagging compared to other industry. And overall equipment efficiency or a cycle time. In all these parameters, pharma industry is lagging compared to the world-class industry. So when you talk about value chain, when you talk about the patients to be delivered, then you need to look for any innovation which will carry forward for entire value chain. And not only the cold chain, not only the airport, not only the airlines or a forwarder. We need to look for entire broader value chain and the innovation, and we come to your point, that value innovation may not be a technology or using a blockchain or using something. We need to have innovation which will be crossing entire value chain, and how you will deliver to the patient timely. There are many products or which you will find that their cycle time is so long that they are produced only maybe into yearly, only twice in a year. Can it be done? And today, if you look at from where the world is changing, if you look at in pharma, you have the global, every pharma industry is becoming global. So you have more complexities, geopolitical situation, then increased. And accordingly, when you are becoming global, you have more contract manufacturing organizations. The distribution channel in pharma is very big. You have contract manufacturers, they have their suppliers, they have their suppliers. Then you have, after manufacturing, you have logistics companies, then wholesaler, distributor, retailer, hospital and patient. So the chain is very complex. So when somebody handling warehouse says, I have 100% traceability or visibility in warehouse, it is of no use to the patient. You need to have a visibility, transparency, right from the supplier of contract manufacturer or manufacturer till the patient. And you need to look into innovation in this world. Also what is happening more, we need to see more and more drugs are coming. If you look at 2,400 drugs are under trial. You are going to deliver the drugs to the which are more patient specific. They are going to be more complex. How you are going to handle this? At the same time, your regulatory authorities are going to increase. You are facing on one hand counterfeits. So all these things, my first take is this innovation should not be talked only for supply chain. Unless you coordinate with all the parties, I think it will not be innovation. That's what my first take on your.
No, I think it's super true, but at the same time, kind of, so the challenge is like who puts the bell in the cat's neck, right? So that's there are so many parties. It's always inherently complex and messy. Like where do you start and who coordinates? And probably I think the business of supply chain.
I was just looking at what Pramod was saying, and I think you rightly captured the whole essence of value chain. And I think Harshad, you captured the word customer centricity and how do we, focus our innovation on that. I just wanted to throw a thought across, which is that traditionally, from a manufacturer's mindset or from an industry's mindset, supply chain has always been inside out, so we have thought about our enterprise as the first enterprise. And we've traditionally organized supply chain as, plan, source, make, deliver into the customer. So we first start about planning for our business. And then, when time comes, we think about what customers' plans are. And I think that's the big, let's say, fallacy of our supply chain mindset today. And if we really want to embrace innovation and customer centricity, it has to be almost customer in rather than manufacturer out. And what I've kind of, over the last 5 years, what I've come to realize is a better model is probably a model of understanding demand generation, demand capture, demand fulfillment, and then, of course, fundamental capability to actually fulfill as well through manufacturing and procurement. But more outside in rather than inside out. And if we can do that, I think it starts to unlock a different mindset of thinking. It is about first understanding what are the drivers of demand generation. For example, if we are really truly patient-centric, we would try to understand, okay, why do certain therapies have a certain demand pattern? Why do certain medicines have a certain demand pattern? What do they really depend on? What is the data telling us about that? What can we do to capture that demand better? What can we do then to fulfill that demand better? And what can we do to plan for that capacity that is coming our way? And in Pharmarack, that is what we are trying to do. It's a big shift in mindset of the industry. But what we are trying to do is to create more proactive disease surveillance and monitoring platform. And then correlating that to pharma availability, correlating that to demand sensing in some ways, correlating that to then demand capture mechanisms. Are we really able to capture it through the right prescriptions capture or the right chemist order capture? And then, of course, correlating that to the right availability at the stockists and the availability at the manufacturers and CNFs. So I think this shift in mindset is something that we are really excited about, that the platform can do, and that's what we call the entire journey of commerce to insights, or insights back to commerce. Because I think supply chain has to be driven by fundamental customer insights. Right. And then you have to fashion your commerce or design your commerce to then support those customer insights and fulfill those customer insights. And the last word I would say is that I'm a big believer that innovation, any innovation, whether it's supply chain or product innovation, must be focused on solving problems. And I think once we start to understand what are the problems related to demand generation, what are the problems related to demand fulfillment, we really start to do much more accurate innovation. And when I say accurate innovation, innovation which will be adopted. There's no point in innovating something which will not be adopted. And what we are finding is that we are spending a lot of time trying to understand these problems with our customers and then hopefully trying to solve them.
You have given me a couple of points that I want to dig deeper now. Because let's take that, value chain thing was great, right? So there are inherently multiple players involved. Supply chain is, many VCs nowadays are finding it out the hard way that supply chain, the business of supply chain is messy inherently. It's not going to be 10x, 100x kind of valuation, just like what you can find in a pure play software product. Because there are multiple players involved. And one thing I want to throw out there, I've been thinking about that. Is it that supply chain, to sustainably innovate in supply chain and push the envelope farther and farther continuously, do you need to go to a utility model where it has to be someone else's business supply chain needs to take everyone's ship up? Eventually the end state is that it's not going to be a competitive advantage for one or the other player, and only when that happens, like cloud computing has done for computing. So the people who are managing cloud computing as a business, it's in their interest to continue to innovate and continue to cut the cost, and that kind of helps everyone in the industry. Similarly, supply chain needs to be a utility, and then it has to be a business in itself. It could be an Amazon, it could be a Pharmarack or someone like that. Is that the only model that could work? That's one question. And the second thing, I'll hold it for later, but I think what you said about innovation that works. Innovation inherently, I think there are going to be some failures. How do we tackle that? But I think let's talk about supply chain as a utility idea.
I can throw in my 2 cents in that. I think it will, having seen the evolution, I think it will be a mix. It will always be hybrid. I don't know whether supply chain will totally become a utility, but it's the economies of scale, the shared capabilities are going to be irresistible in some areas. And will actually break the logic of completely owning parts of it. I think pharma industry does really well in terms of leveraging shared manufacturing in a big way. In fact, a lot of contract manufacturing in India is actually very highly shared. So it's there. I think what pharma industry probably could do even more is share the whole interoperable digital protocols. Because if you really want to drive the digital part of the supply chain well, given that it's so complex in pharma, given that there are so many relationships, I think those interoperable protocols will have to be by design shared. If any one company wants to build its own protocols, I come from an industry like FMCG where we don't touch anyone else's protocol. It's our pipe, end to end, if you have scale. But in pharma, I think it's very difficult to imagine that even the largest player, I don't think, can build that those protocols. Right? So I think that will be there. But fundamentally, understanding your customer, understanding its problems will be a unique competitive advantage that everybody must build the muscle on. Yeah. I don't think that can be shared because part of that supply chain knowledge will be competitive advantage. Part of the sharing will be inevitable and will have to move with innovation.
Pramod, what do you think? I think you have had your own experiences in that regard. I think the idea is not new.
Yeah. So what you mentioned is very interesting. Say, for example, innovation. To do any innovation, you need to have that mindset as a culture to be developed. And when you have mindset and culture you have developed internally on innovation, then you can look for a collaboration and the stakeholders. So first of all is that you need to think that yes, should I, whatever demand I get, I should produce, or I should take a 2 steps to collect everything and then do that. Then the collaboration can be done, which we have seen the example, definitely the common manufacturing which is used, which is a quite good example. So in that case, to build this cooperation model is possible. And to your really answer the question, without cooperation with at least some level of people, it won't work. It won't work at all. I mean, 1 or 2 industry trying to do something will not have. So it will require some cooperation, and it is possible to that extent because you are having at least some common manufacturing, you are having many common wholesalers and distributors, which is already there. So it is possible that you can build this collaboration to have some innovation in mind, definitely, which will solve the problem. So there is a groundwork on which, but your question to answer is very difficult. Who will take the lead is always tough, because who will take the lead? You have examples, or you always feel that somebody who takes the lead put hard work, less benefits. Somebody who copies that after a few months, he gets the maximum benefit.
Pioneers take the arrows in the back.
Absolutely. And in innovation, you will have always such example. Those who have developed a great products, they could never sell it. Yeah. Absolutely. So my feeling is that unless you find out some collaboration, first of all, build the mindset that I wanted to do something for patient, I wanted to change this situation, and then find out the people who will collaborate with you. Technology, see, there will be technology is always, now people are pushing technology. People are telling blockchain is great, you should use blockchain. People are telling this is great, you should use that. But if it is not making sense, yeah, I feel that you find out what you want to achieve, what is possible. Technology will be able to give you everything.
I mean, never trust consultants. That's the
you are saying that, and I'm sitting in between, and he is different. So what we are talking is
you're coming on our side now. Yeah.
So
no, but it's so true, right? So what we talked, always start with the problems and always start with the customer first, and that work backward. I mean, there are so many examples. I mean, I know Amazon and P&G, you know Unilever and Siemens. So there are so many examples, but somehow people still forget that never start with the technology. Yes. There is often that because it feels easy, right? So feels easy to get busy with some new thing because understanding the customer unmet needs that they are not articulating, it's so hard. And having the mechanism developed that you're constantly innovating on customers' behalf, it's so hard, versus falling on the next trend is relatively easy to get busy with, right? So, but I think maybe let's change gears a little bit. So we have talked about the value chain and the real innovation that takes, it has to take that end-to-end view. But even in the limited sense, where we are just looking at our companies and trying to do digital innovation for some specific problems, even that small scope is also difficult many times to get it right. And many times, at least in my experience, is the culture of innovation what you have as a leader. You are setting that culture, allowing people to fail and experiment a little bit, but at the same time still keeping an eye on the ROI. Both of you have been in those positions for many, many years, leading large teams and driving innovation. So I would love to hear about your perspective, Alok, and then Pramod. How do you manage the team aspect, getting people motivated for doing innovative things, allowing them some room to fail, but at the same time keeping everyone on task to deliver the ROI?
Want to start, Pramod?
Okay. See, if you look at any technology or digital implementation, we always believe that you need a good core team and a cross-functional team which will cover this value chain, really what we want to solve or what we wanted to give to customer. So when this team, core team needs to be in place, then they can decide what type of technology platforms are available. Yeah, that landscape, based on that landscape, I mean to say landscape mean from that technology you need to deep dive that whether this technology is suitable, whether it is going to answer my questions or they are going to solve the problems, that needs to be deep dive into that. Then one is whatever solution which you are thinking, how it fits into your business or your operations company strategy. You need to think about that. And if you look at these graphs, you must be famous that how many technologies came, how many years they lasted, how they got vanished after some time. So what technology you are talking about, say 3-5 years, you have some arrangement that, and you are confident that this I use, then it will be available for 3 years, it will be available 5 years. And second is that when it will start delivering to me, because there is a period for implementation, there is a trial, everything is going to happen. So how it is going to do the implementation, then one solution will not fit everything. So probably based on your problem areas or what you want to deliver, you may have to use different solutions within company or within different geographies also, I find, because some geographies will not need that solution or they may not have that problem. So you need to think on that. And always we found that anything which you are implementing, you do a pilot. This pilot may be successful or it will fail. There will be some pilots will fail. Then you take the pilots which are successful, try to implement it on a larger scale. This is what, and very basic words I can tell how we can go about technology and digital implementation.
I think, completely agree with what Pramod has said. Maybe just a few things to add. What I found over the years is top management commitment is extremely, extremely critical for driving a culture of innovation. There, a lot of times it becomes the flavor of the month. It becomes the guessing game on which color does the boss like. And there, I think it's imperative on leaders to really be very sharp on what is the change you want to see, and not, be vague or be very expansive, right? So I just give you an example. So, in Unilever, or I think in a lot of enterprises, service measurement is about primary service measurement. And one of the things that we wanted to fundamentally change from the perspective of really being more customer centric is to start the concept of secondary service. So what is the service of my customer to his customer? And maybe in future tertiary service, what is the service of my customer's customer to his customer? Really the patient, right? So unless because the reality is if you don't measure, you don't improve. And innovation is about improvement, and therefore innovation must be about measurement and must be about sharp changes. And I can tell you it was almost a 10-year journey on sharpening our program and really delivering best-in-class secondary service. But it happened because senior management decided that that's the one goal we want to chase, and we are going to stay consistent over the years in asking the team to do everything that they possibly can to drive secondary service. And that really spawned such a culture of innovation because it forced everybody to think about what would impact your customer's service. That hitherto was not even thought about, right? So I think innovation is about fundamentally trying to break that paradigm, break it in a very clearly defined step-up change, have one or two metrics or KPIs which significantly would impact, constantly encourage the team to experiment, because frankly, if it is out there, some of the things that you do will fail, but stay consistent to that goal and applaud whenever you achieve small successes. But what I've seen, if you do that, you do achieve big goals. And the last word of health warning is that never be swayed by glamorous tools, because you will be sold a lot of tools almost every quarter. But remember to ask that question, is it going to drive this one or two things that I'm chasing? Is it going to make a fundamental difference to driving these goals, driving this change? And if it is, then certainly bet behind it and be ready to fail. But if it is not, just ruthlessly discard.
That's such a great point, right? So be specific, but that specific goal is not tomorrow's goal. It's 10-year kind of view, and then allow people the freedom to on the how they achieve that goal, because that goal then transcends the current leader. It becomes generational, because oftentimes what happens, and I have had so many of these experiences, often people want to create an internal innovation team, and I've had so many opportunities where job offers and whatnot I run away from, because typically what I've seen is it becomes a flavor of the month. That, yeah, we will do the long-term commitment, everything, all that is just words. First year, everyone is going with big fanfare. Second year, people start losing faith in long-term and start focusing on show me the money. And third year, everything dies down. It could be a 2-year cycle, it could be a 3-year cycle for some other companies, but it goes through these 3 phases. And there are so few companies who are consistently, no, this transcends the current leadership. We are consistently going after that one North Star. And underneath that context, then we are building the innovation engine. So it's rare to do that. I think there are a few companies who have done that successfully.
Harshad, I was having one also point in innovation. So this is very right that it need a consistency, and this is always there that the top management thinks, and then every month that reports, first people keep on discussing, and then it becomes a routine really what you have done. But one more thing, and long term which you have used, you need to think for innovation or technology for a lot of long term goal, that how the pharma or equipments are going to move in couple of years. More and more wearables are coming. So that is a new area where probably you are able to apply technology much. How the wearables are going to change, how are the personalized medicine is going to change, or how the trials, clinical trials can be done at home, which permissions are coming. So these are the new growth areas where you can think what can be done ahead of others, or you can do innovation. So one is growth area, new area is also area where you can look for innovation.
Got it.
Absolutely.
Yeah, I think one of the things I'm just thinking out loud here, the people who are really innovating are not saying that they are doing innovation. Right? So they're just doing their business as usual. They're serving the customers. They are intimately aware of what their customers want and what the drivers for the business success. And it becomes the, but sometimes I think that separate innovation team becomes the trigger for getting the excitement in the organization, and they do that right as well. So I think there are so many examples, right? So who are doing all those things correctly, and then there are others who are just kind of not thinking through the implications on the business and just taking the flavor of the month approach. So I think super cool insight. We have like 5-6 minutes remaining. I do want to touch upon one critical thing. What excites you when you think about Pharmarack and overall supply chain? I think, Pramod, you have come out of Siemens. You are doing much broader role now as a industry expert and consultant. But in terms of, it could be a technology thing, it could be a business model thing. But as you think about innovation, what pops up? I mean, what's the...
I tell you what excites me is the potential of really, and I don't know, I don't want to sound a bit bombastic here, but potential possibility of impacting a very large and critical industry. And I think, we are known, I mean, pharma industry of India is known across the world for its size and scale. I think we can also be known for our innovation, not only on our products, but also on our supply chain. I think if we can do something which is really customer centric, which really helps to improve the quality of healthcare at the hands of the patients, if it makes healthcare more affordable, and there are millions of underserved Indians who probably need our supply chain to perform far better than what it does today. So without running it down and really giving a due credit of where it is, I think there is a huge potential of creating something which is transformational for the country, and that's, I think, is a good enough motivation for me to get out of the bed every day.
Yeah, I think you really covered it really very well. When I look at it, I find that many industries where maybe initially globally you are lagging and then you come, but then you have advantage to really become a great, because you are able to adopt many new technologies, innovation. So in pharma, we are having a really good base from where you can really take a leap, whether that is in innovation, whether it is in sustainability, or whether, as you mentioned, the improving the health. We have great chance to take a leap from here to become one of the great industry. I think we have that chance, and that is really exciting.
Awesome. I think I'll also end on that note. So as you both know, I recently relocated back to Mumbai after being away for 20 years, and came for family, but now finding the whole energy here and the excitement and the opportunity to be too exciting. There are 100 different directions we can go and still not have enough time, right? So and energy to do everything that's out in front of us. So I think we can potentially end a session on that positive note. I think great time to be in supply chain, great time to be in pharma. Lot to do, and innovation, I think it's going to be not a choice. I think whichever way you define it, I think we are paving a new path here. It's necessary.
Yeah. So, but Harshad, before going, I really wanted to thank participants. I mean, those who are really keen and they have stayed back till such a late. So, I really wanted to thank every participant here. Thank you very much.
Thank you.
Thanks a lot.